Human body composed of heart, which have ventricular muscle, atrial muscle. Heart have two sides. One is right side and the other is left side. From right side, blood goes into the lungs, and after it enters into the left region. In the left region, it goes into the aorta, and blood arrives into the arteries. The cardiac cycle simply have two types of pressure. One is diastolic pressure, and other is systolic pressure. When cardiac muscle is at rest position, known as diastolic situation, when cardiac muscle produce action potential, when blood goes outside of the heart, it is known as systolic pressure, which is 120 normally. Look at this structure. Our heart have superior vena cava and inferior vena cava. From superior vena cava and inferior vena cava, blood enters into the ventricles, and from aorta, it arrives into the arteries. Here the superior vena cava and inferior vena cava, aorta, pulmonary arteries. Heart have 4 chambers, 2 atrium and 2 ventricles. From these chambers, actually, what's the cardiac cycle? The situation depends upon what is happening between atria, what is happening in aorta, atrium and ventricle. Atrioventricular rail, these are cardiac muscle, known as ventricular muscle. Now, right atrium, right ventricle, left atrium, left ventricle. When blood enters from superior vena cava and inferior vena cava, it goes into the lungs. When it enters right atrium and left ventricle, filled it with blood. What? The blood fill it in the ventricles and is in rest situation, known as diastolic pressure. In this condition, ventricular pressure is smaller than aortic pressure. Aortic pressure is larger than ventricular pressure, known as diastolic pressure. Because muscle is in rest position, there is no action potential. Now blood goes into the lungs and it again enters from the left atrium, from pulmonary arteries and veins. It entered from left atrium. In the left atrium, ventricle fills and action potential generated. This action potential in the ventricular muscles have 4 phases, known as, look at this diagram, I'm showing you which type of phases in action potential. And this ventricular muscles, which is 15 times greater than skeletal muscle, phases in cardiac muscle 0, 1, 2, 3 and 4. In the 0 phase, calcium channel open. When it goes in the first phase, it closes, this channel closed, and potassium channel open. Potassium channel goes in the second phase, potassium channel closed, and calcium channel open. This situation known as repolarization. When sodium channel block, when sodium channel close, repolarization, no repolarization. When when calcium channel, because in the second phase, calcium channel open. Now it goes in the third phase, calcium channel close, again slowly potassium channel open. This situation known as depolarization. When potassium channel goes into the fourth phase, this situation known as resting membrane potential. In cardiac muscle, which is 80 to 90 millivolts, action potential in cardiac muscle 15 times greater than skeletal muscle. These are specialized types of muscle because cardiac heart have special types of muscle, except only cardiac have specialized type of muscle, because you will never find this kind of muscle in other parts of body. Skeletal muscle are 40% in body, composed of 40% of human body. Now, I hope you understand this mechanism, what's the action potential, and I hope you understand diastolic